Hi everyone, today we are going to discuss about mortality. First of all, introduction of mortality. Mortality refers to the occurrence of disease in a population during specific period of time. It is an important measure in epidemiology and public health because it helps to assess the health status of population, then identify major causes of death, evaluate health services. Then, the definition of mortality: the frequency of death occurring in a defined population during a specific period. It included more data useful for it and the measuring status of health of community. Then we included in the identify major causes of death and comparing the mortality between the different population, identify high risk groups. Then planning and evaluating the health services. Then it included the studying in trends, diseases and the mortality, evaluate the effectiveness of disease control programs and allocating health resources, it developing the public health policies and estimating the life expectancy. The frequency which death occur a relevant event in mortality is death, the not including the fetal death. It occurs due to the one's only determinants of mortality, socio-economic status, the public health behavior, including medical technology. Life expectancy means you can divide the total population into different groups to compare some of these differences within population. Rich versus poor, urban or versus rural, then male and female, ethnic groups, age. These are the life expectancy factors. The life expectancy figures can be affected by high IMR. If you survive infancy, you could live much longer than life expectancy figures suggest. Then the death rate, the problem which using the CDR, that is affected the age structure of the population of a country. If all other things are equal, the CDR goes up to the average age of population goes up. Then the age sex specific death rate. The death rate of particular age group within the population, it include male or female category. Then death is the most common to the youngest and oldest cohorts. MCDs means decreases the death rates occurs in late industrial revolutions and it due to improved sanitization, proper sanitization, water, housing and reduction in population. We improved our medical care. Then improved our nutrition, less death from infectious disease and advances in agriculture. It improvement in personal cleanliness and the cloth washing, hand washing, hand washings and public interventions are the factors included. Then the uses of mortality rate. First, useful of projecting the future sizes of population, then identify the population groups that are at high risk and indeed of the health services. The indicatives of qualitative life and expectations of life at birth. The uses of mortality rate is useful to guide to planners and help to insurance the companies. Fetal death. Fetal death means the death prior to the complete expulsion or extractions from its mothers of the products of conception at any time of pregnancy. Then stillbirth, death of fetus after completing 28 weeks and till the time of birth. Then the another one is incident rate, The number of new cases or specified diseases occurring in the defined population during a specific period of time. Thank you.